The management of Edo Specialist Hospital in Benin City have commended the Governor of Edo State, Senator Monday Okpebholo, for his crucial role in the advancement of healthcare in the state during a press briefing held in commemoration of the 7th anniversary of the institution. Speaking during the exercise, the Chief Medical Director, Dr. Anthony Inibokun Njoku, praised Governor Okpebholo and his team for the administration's commitment to promoting primary and tertiary healthcare, especially in the investment in facilities and equipment to strengthen the state's health sector.
Today we gathered not only to celebrate 7 years of Edo Specialist Hospital, but to reflect on a journey of resilience, growth, and an unwavering commitment to delivering quality health care to the people of Edo State. I want to start by sincerely appreciating our dear governor, our Akpako Rescue, our Akpako Health, as we have termed him in Edo Specialist Hospital, distinguished Senator Monday Okpebholo, the Executive Governor of Edo State, for his steadfast support and commitment to strengthening our healthcare system. He has done so well from the primary healthcare up to the tertiary healthcare, and members of his executive. And we can say that the Deputy Governor is also a very strong friend of Edo Specialist Hospital. In the same vein, I equally want to thank our Honorable Commissioner of Health, Dr. Cyril Adams-Oshomole, who has been a very strong vanguard in making sure that all we set out to achieve, we achieve them. One of the first things that happened when we came on board was that His Excellency graciously granted this hospital the need to expand its manpower base. So, right from the very beginning, when we came on board, we found that we have 126 contract staff that are yet to be onboarded onto the Edo State workforce platform. And His Excellency graciously granted that to us, and we're able to onboard all of them, all the contract staff. And not only that, we also did a gap analysis and realized that we needed a lot more staff. His Excellency also granted us the capacity, the ability to be able to employ doctors, nurses, allied health workers, and today we have them.
Dr. Njoku also recounted strides made by the institution in areas of expansion, staff recruitment, training accreditation programs, subsequent partnership with Mudi Amen University for medical collaboration for students, and the announcement of the provision of vitro-fertilization equipment by Governor Okpebholo in a bid to expand access to reproductive health care under the SHINE agenda.
Permit me to announce to you that the couples in Edo State will soon start smiling, or should start smiling already, because the government of the day has procured IVF equipment for us, and so we can start to the process of assisted reproduction. So in the reproductive health, we can say that a lot of our couples who hitherto find it difficult to have their own babies, we can have them solved. Now, if we combine our accreditation with even these equipments that have been procured for us, you can say that a lot will be achieved with all of this. Now, we also had, when we came in, we also had some ailing equipments that needed to be revamped. One of it, I'm sure my dear MLS will be smiling now, is that we had to get some laboratory equipment, particularly a chemistry analyzer, because a big one, because the volume here is high. We also had increases in the number of patients who access this facility, and we needed to also expand the scope of our services. And in doing all of that, we were able to get some equipment like the IVF equipment, even our laundry. You can see when you come in here, one of the things that greets you is how clean the place is. We have tried to maintain, a clean work environment, because that's a very important factor. We also had other equipment that we procured, more phototherapy machines for our NICU, that's neonatal intensive care units. We also did, even in our renal dialysis unit, we have also done that. And in the biggest of it is with our ICU. When we came on board, the intensive care unit of this hospital was moribund, was out of use for like a year because of equipment that had run down. And so the very first equipment I think that was purchased for us was a ventilator, and that's because we needed to revamp the ICU. Now this hospital is a hospital that, apart from being a tertiary specialist hospital, it is centrally placed in the city of Benin, in the ancient city of Benin, and that means that what we get to see is a lot. We get to see a lot, so a lot of people are running here, and so it's difficult not to have. You won't be able to take all, but not to have services like intensive care unit. And so when we cried to the government, they said no. So that was the very first thing we were able to do, to put up our ICU together. And ladies and gentlemen, I want to announce to you that we have been putting this ICU to work. We've also onboarded more anesthesiologists, because you need the manpower to also run those services. And I can tell you that we have had good successes, and we will continue to expand and have good successes. So, like I said, one of our proud achievements is the accreditation exercise, which we have had full accreditation. When we mean full accreditation, it's not an easy feat for you to apply for the first time and you are given a full accreditation. The accreditation usually is partial because they want to see how you're doing. But when they came in here and saw and assessed our facilities and assessed our manpower, what we had on ground, and they said, no, this hospital is beyond what it is currently being known for. So they granted us both colleges granted us full accreditation. We are hoping that we'll have the same feat with the family medicine, and we are preparing to go on with family dentistry and the rest of all of that. And one of the other things we did, because when we came in, we said, what is our vision? Yes, we want to talk about service delivery, we want to talk about training, and we want to talk about research. And like I've explained to you about what we have done with trainings and how far the scope of which we have gone with trainings. But we also know that for us to be able to do research, we need to have a lot of support. And so what are we doing in this direction? Currently, we have signed a memorandum of understanding with the Mudiame University in Ira to be its teaching hospital. What that means that when it's a teaching hospital, we are able to do far more than we're doing that. We are able to position ourselves to be able to receive grants to do a lot of research. Now, we didn't just pick Mudiame University because a lot of universities have been approaching us, being the best bride in the market. So they've been approaching us for such partnership. We chose Mudiame University because it aligns with our vision too, because they seem to have a flair and a big capacity to expand research, and we felt that collaborating with them is going to bring that to bear. So like I said, currently we have signed the MOU with them to serve as teaching hospital for its medical students. This partnership strengthens our role as both a healthcare provider and a training institution.
The exercise was then followed by a media tour of the institution led by Dr. Suleiman Ozemoka, which gave journalists a chance to assess equipment and services provided by the institution. Olumide Abiodun Mudashiru, reporting for PFM Global News.